My name is Brett Hicks, and I teach the health policy course, the Introduction to U.S. Health Systems, Research Methods, and Epidemiology. My background in health administration is actually from the military. I spent 20 years in the U.S. Navy as a healthcare administrator. So I've gotten to do various levels of healthcare, from working actually in the delivery phases as a medic, up through middle management and up to senior leadership to actually guide policy and shape policy and how that's interpreted in the hospitals. I think my enjoyment is just interacting with students. I think that's my favorite part. I enjoy exchanging ideas with them and in the discussions, and then the virtual office hours that we have. It's nice to have some real-time one-on-one communication, and the students ask terrific questions. They really get into the subject and ask me, real-world questions. Say, hey, this week we were talking about this, and this happened at work this week, or next week we're taking on this project, whether it be, looking at falls and trauma in the hospital and hospital-acquired conditions, or whatever the subject means. So really to engage them on a one-on-one level in real time, and talk through issues and share some of my expertise and my, what I did in those situations, and hear their feedback that's my favorite part. I enjoy working with students. I think the best way graduates contribute is they take those tools and they lead in healthcare. They demonstrate some of those. They master the tools that we gave them. I mean, we try our best in the short time that we have students to get them to a level of mastery. And obviously each student reaches that level at different times, but we want them to continue that pursuit, continue their education, maybe take on additional certifications, maybe even go for another degree or a doctoral degree. But we really want to see them be leaders in the field and really, maybe some publications, things like that. I mean, nothing, for a faculty member, nothing makes me happier than to see a former student, in the Journal of Healthcare Management or in a peer-reviewed journal that wrote an article based on some practice that they applied at their facility or some success that they had. So it's really good when they can use those tools. And, it helps from a marketing standpoint if they, where did you're a very good leader, or you're a very good employee, where did you get your education? And I got my education at Ohio University. The key benefit to our program is we're going to give people that real world experience in the class. I think that the courses are designed, the assignments, the professors' teaching style is geared towards that. We want them to learn about health administration, of course, and we respect the academic part, but we also want to give them the tools and the confidence to apply what they're learning right now, because we all agree that that's very important for adult learners. I remember in a particular case I had a student that just really didn't feel like she was ready to do graduate school, certainly didn't feel like she was ready to do it in a distance environment. So I had a lot of one-on-one time with her over email, and actually we ended up setting up a couple of phone conversations where, I coached her through it. I told her, she's going to be able to do it, to have some faith in herself, that she got to that point because she was a good student and she was intelligent and she had the skills, and that we were going to get her there. And she did well in the course, and she emailed me probably about 6 months later, so about 2 more classes into it, and said, I'm glad I stayed, because she was kind of on the brink. She wasn't sure if she wanted to stay, and she said, I'm glad I stayed. I'm loving the program. I learned a lot from your class, and I'm using a lot of what I learned in your class in these other classes. So it was good. It made me feel good that we held on to her, but also that she realized, that we helped her realize that she had what it took to get through the program. It's a terrific program. I enjoy teaching it, and I enjoy being a part of the program.